With the advent of HIV, we find that HIV has been closely associated with tuberculosis and vice versa. So what it is that the people who are living with HIV tend to suffer more from tuberculosis as compared to those who do not have HIV. Then again, we see that the diagnosis of TB and HIV is very difficult. We also see that the outcome of treatment in people living with HIV may be fatal, or may not even be there in some cases if it is delayed. Again, we find that tuberculosis can easily spread from someone living with HIV to someone who is not living with HIV because the diagnosis is difficult. So we find this strong relationship between TB and HIV. Now what you find is that those people who have TB, up to about 70% may be found to be HIV positive, and those, for instance, who have HIV, of course I may not estimate the percentage quite alright, because it ranges from 10 to 30% of those people who have HIV having tuberculosis. But as I've said, it's very difficult to diagnose tuberculosis in people who are living with HIV. Tuberculosis is a big burden in people who are living with HIV. Now, there are some measures that have been put in place globally, recommended by WHO, to reduce the burden of TB in people who are living with HIV. We have the concepts of 3 I's. I'm sure you've heard about that one, where we're talking about ICF, intensified case finding. Then we've got IPT, isolated preventive therapy, and infection control. Now IPT specifically looks at TB prevention. So we are talking about an intervention or some method that you use to prevent TB using drugs. So what happens is that when someone has got TB in the body, it does not become active immediately. Does not become disease once someone is infected. Now, to prevent the activation of this TB to turn to a disease, isoniazid preventive therapy is given. There is a drug called isoniazid. So that drug is given for about 6 months to this particular person who is living with HIV, and it is hoped that that person living with HIV may not suffer from TB for the next 2 or more years. We have had a study, ZAMBART study, and ZAMBART study has been about the reduction of the prevalence of TB and of course HIV. So now what has happened there, it's a community trial. So this community trial has got an intervention. One of the intervention is called household counseling. Now this is I would call it an intervention where you use a TB patient as an entry point to a household or to the community, I would say, at large. So you
recruit a TB patient from the clinic and get the consent or talk to this particular person and go to the community or enter that particular household, and then at the household level, that's where you carry out a lot of TB activities, not only to the client or to the person who has TB, but also the entire family. So what you do is you offer what we call TB HIV education. In other words, you offer education about TB and HIV. At the same time, you encourage people to test within that particular household, to test for TB and to test for HIV. And if you find that there are some people who say who have HIV, you make sure that you link them to the service providers or just as the health center for further HIV care. If you find people have got TB, make sure that you link them to the services at the health facility for TB treatment. And you don't just end up there. You also make sure that you monitor them. So you don't just do one visit. You plan a number of visits for about 6 to 8 months, just to ensure that those who are on treatment adhere to the treatment.
When it comes to household counseling, we have a plan to make sure that it does not end at the research level. So what we have done is we did a stakeholder analysis where we looked at a number of partners in areas where we're operating. And I think the key partners we found were those under STAMPP, that is Strengthening TB and Malaria Prevention Programme, and these are Care International Zambia and Car Counseling. So we thought these partners would help us really sustain the household counseling. So we decided to train their caregivers in household counseling. Basically what we were doing was just to impart skills of screening for TB and screening for HIV at the same time, and then improving the referral system for TB and HIV care. So especially the referral system at the health facility level, which has always been lacking in a number of these home-based care interventions. So we hope that with integration of household counseling in this say home-based care and all these HIV services, this is going to be sustained, because most of these are permanent most of these organizations are very, very stable. Now we're also talking about the government. Of course, we expect the government, especially through the efforts from CARE, that the government is going to also carry forward the household counseling, because government has worked with CARE for quite some time and they have been working together, especially in the community. So we hope with this integration in this existing care sort of services, HIV and TB care services, will be able to sustain the household counseling